Last week, the CDC lifted the no-sail order that banned cruise ships, and while this news is really good for the cruise industry, there is still a lot more work left to do, and I'm going to break down what you need to know about cruises actually restarting in the United States up next. Hey everyone, it's Matt from RoyalCaribbeanblog.com, and like you, I was super excited when I heard that the CDC had opened a pathway for cruises to restart in the United States. The no-sail order had been a major barrier for the cruise lines, and it looked like we would finally be able to hit the high seas again on a cruise ship. Well, not quite. Yes, it's an important milestone on cruises restarting, and it provides a clear pathway for resuming service, but there's still a lot that cruise lines have to do in order to get permission to cruise again. To resume operations from U.S. ports, ships must first address conditions set forth by the CDC as part of a phased-in approach. The first part, which is outlined in over 40 pages of findings and conditional requirements that the CDC has put out there for keeping crew members safe. First, cruise ships must implement testing and other protocols for the safe return of the crew. Non-revenue test sailings will follow, with vessels then required to request and receive approval to resume sailings with passengers on board. Now, further technical instructions will be posted on the CDC website at a later date, but in the meantime, the CDC has provided a pretty good overview of what cruise lines and passengers need to do in the interim. And we're going to dive right into everything here as part of the restart plan, starting with the fact that the CDC did actually read your comments. If you remember back in July, the CDC issued a request for public comment, which generated over 12,000 responses from everybody, including experts, regular cruisers, scientists, and everyone else in between. And after sifting through all of them, the CDC said that about 75% of the respondents supported the resumption of cruises, which is great news. Next, ships will be individually evaluated. When considering the extension of the no-sail order, the CDC determined that a more flexible, tailored model would be best that allows cruise ships that have met the requirements to resume sailing. So this allows individual cruise lines to progress through phases at variable paces. This enables cruise lines successfully implementing public health measures to return to passenger operations more quickly, while others, by necessity, may move more slowly. Okay, Matt, when are voyages actually going to resume? All right, let's cut to the chase here. When will voyages resume? Well, there'll be 4 phases to them. The 4 phases through each ship will have to pass in order to be allowed to sail again are as follows. Number 1, COVID testing for all crew members via the establishment of testing facilities both on board and on shore. Next, after that is done, non-revenue sailings that allow crew to respond to simulated virus scenarios on board. So these are these test sailings you may have heard about. Next, a certification process that grants permission for compliant ships to return to service in the U.S. And lastly, a return to sailing that mitigates the risk of virus infection and spreads and accounts for the safety of passengers and crew and local communities. In order to comply with testing for all crew members, cruise lines have 60 days to establish shoreside testing facilities for both new crew and those currently on board, as well as onboard facilities to test those with symptoms. Crew members must be retested on a weekly basis. The onboard facilities will eventually be used to handle passengers testing, of course, when voyages actually resume. Now, the permission to sail may be denied or revoked at any time. Although the no-sail order's expiration is really great news for the cruise industry, the CDC says there's no guarantee that ships will be granted permission to sail even if they submit a request to do so. If permission is granted, it can be revoked at any time for failure to comply or based on the frequently changing nature of the virus, and new requirements can be added at any time. Yikes, indeed. Now, something that you should know as a passenger is at the CDC's request, cruise lines could share your information. As part of the requirements for compliance with the CDC, cruise lines will be required by the government to provide the agency with access to various avenues that will allow them to gather information in the event of a virus outbreak on board. Now, according to conditional sailing document, that could include manifests and even your medical records. And here's a direct quote from the document. Quote, upon request, cruise ship operators must make their properties and records available for inspection to allow CDC to ascertain compliance with this framework. Such properties and records include, but are not limited to, vessels, facilities, vehicles, equipment, communications, manifests, lists of passengers, and employee and passenger health records, end quote. Another important step for the cruise lines to accomplish before conducting simulated sailings without passengers and applying for a conditional sailing certificate from the CDC is they must have documentation of plans to evacuate passengers to local hospitals or quarantine isolation facilities on shore should evacuation be necessary in the event of an outbreak. Ships must also have agreements with local port authorities to ensure the number of cruise ships is limited on any given day so as to avoid potential overcrowding of local healthcare resources in the event of an outbreak. Now, if you heard about these simulated voyages, these test sailings, and you'd love to get on them, well, we're not quite sure exactly who will be able to get on them, apart from maybe cruise line employees, but there are several restrictions related to that, including the fact that no kids are going to be allowed on these test sailings. In several cases, shoreside cruise line employees are being offered the chance to sail so that ships can test out their new protocols. Under the CDC's order, the conditions state that cruisers on these voyages must be at least 18 years old and sign paperwork to acknowledge that there are risks associated with a test run. Additionally, all crew and voluntary passengers must follow testing protocols, which include rapid testing prior to both embarkation and disembarkation. And the cruise lines must conduct a monitored observation period and laboratory testing of volunteer passengers as directed in CDC technical instructions or orders prior to embarking volunteer passengers on a simulated voyage. And speaking of the simulated voyages, they must enforce all guidelines and conduct test evacuations. If simulated sailings are to meet the expectations of the CDC for certification, everybody, that includes the passengers, must wear masks, wash and sanitize their hands, and practice social distancing. Logistical changes must include modifications to entertainment and dining venues as they would appear on a regular revenue sailing. In terms of what they're actually going to simulate on board, there's going to be a lot of dry runs related to the following activities: embarkation and disembarkation, onboard activities, including dining and entertainment venues, private island shore excursions, if they actually stop at any ports, evacuation procedures, transfer of symptomatic passengers or crew, or those who test positive for COVID-19 from cabins to isolation rooms, quarantine of all remaining passengers and non-essential crew, and other activities that as may be listed in the forthcoming CDC technical instructions. On top of all that, additional simulated voyages could be required. The CDC says that cruise lines must keep detailed notes on the implementation of required practices and take steps to correct any deviations. The agency could require additional test sailings, which would allow more data to be collected for ships to correct any missteps in their protocols. The CDC says it also reserves the right to immediately terminate any simulated cruise where cases of COVID-19 infections are available on board. One major change that you can expect off the bat once reduced voyages actually do begin with paying passengers is they will not be longer than 7 days. When regular revenue sailings resume following the simulated voyages and CDC approval, that is, they cannot be scheduled for durations more than 7 days. The CDC reserves the right to modify sailing lengths as the virus conditions allow. Additionally, cruise line marketing materials must clearly state the risks involved with sailing during the pandemic. They must also make it clear that sailings can be halted at any time and passengers could be delayed in returning home if quarantining is necessary. Passengers or crew reporting symptoms must be tested immediately and isolated in single occupancy rooms with private bathrooms. Other passengers and crew must be quarantined, and the voyage and subsequent voyages until further notice must be immediately terminated, and the ship must return to its port of embarkation. Now, that 7-night rule, it's not clear when that would go away. I think like so many of these rules, it's really up to the conditions, how things are going, how these test sailings are going, and a variety of other factors that are simply impossible to predict. Eventually, it will go away, but it's not clear if that'll be, of course, in the first month, 3 months, 6 months, a year, who knows. And the last major thing you should really know about the conditional sail order is it currently is set to expire November 1st, 2021. The order, which is effective from October 30th, 2020, would require cruise ships to comply with these protocols continuously once approved to resume sailing. And the order will be in place until one of 3 following conditions is met: the expiration of the Secretary of Health and Human Services declaration that COVID-19 constitutes a public health emergency, the CDC Director rescinds or modifies the order based on public health or other considerations, or November 1st, 2021, whichever happens first. So with all that being said, what do you think about this new conditional sail order? How soon do you think cruises might restart? Of course, the answer is nobody knows, by the way, if you're going to ask, okay, when will cruises actually restart? We just don't know yet. Unfortunately, even Royal Caribbean has said that they're still working through it. They're working to figure out everything they need to do. And in the meantime, they've actually already canceled their December 2020 cruises, not because the no-sail order is there, but because they need more time to get the protocols up and running. And there very well could be more cancellations to come. We just have to wait and see. So let me know in the comments your thoughts on this framework for the conditional sail order and what you think should happen going forward, and when should cruises start up again. Is this a fair order? Is it not fair? I'd love to hear your thoughts in the comments. Make sure while you're down there, of course, to like this video. Liking videos definitely helps with the YouTube algorithm and helps us do better. And of course, to also subscribe to our channel and turn on your notifications so that way you're told when we have a brand new video to share right here on our YouTube channel. This has been Matt from RoyalCaribbeanblog.com, and we'll talk again real soon.